Have you ever felt that something in your body was slightly off, even though nothing seemed urgent or dramatic? One of my patients once shared that she ignored a small change because she did not want to worry anyone. I want you to imagine this for a moment. A quiet signal appears, and the question is whether we notice it in time. My name is Dr. Evelyn Carter, and I am grateful you are here with me on Senior Health Daily. After many years of caring for older adults, I have learned that timing in medicine can matter as much as treatment itself. Today, we are talking about Nipah virus and why early detection can truly save lives, especially for seniors and the people who care for them. Nipah virus is rare, but doctors pay close attention to it because of how quickly it can affect the body when it is not recognized early. Early detection does not mean panic. It means understanding the body well enough to notice when something feels different from normal. In medicine, those early moments give us time. Time allows the immune system to respond. Time allows doctors to support the body before complications develop. Time protects the brain and vital organs. I have seen patients who did very well simply because a small change was noticed and mentioned early. I have also seen how serious illness can develop when early signs are brushed aside as just fatigue or stress. This is not about blame, it is about awareness. Simple science tells us that early intervention reduces strain on the nervous system and gives the body a better chance to recover. For seniors, this understanding is empowering. It replaces fear with clarity. It helps you feel calm and confident rather than overwhelmed. When you understand what doctors look for and why, you become an active partner in your own care. If this kind of calm guidance feels helpful, please take a moment to like this video, share it with someone you care about, and subscribe to Senior Health Daily. Your support allows us to continue creating thoughtful health conversations made especially for you. In the next part, we will explore what early detection really means, what subtle signs doctors pay attention to, and how timing can quietly make all the difference without creating fear. What early detection really means. When people hear the phrase early detection, they often picture a dramatic test result or a sudden diagnosis. But in real life, early detection usually begins much earlier than that. It begins with noticing. It begins with paying attention to what feels different from your normal. And for older adults, that kind of noticing can be one of the most protective health habits you ever develop. Early detection does not mean assuming the worst. It means recognizing that the body often whispers before it shouts. In my clinical work, I have seen this across many conditions, not just infections. The first sign might be a change in energy, a shift in appetite, a new kind of headache, or a sense that something is simply not quite right. Those early signals are the body asking for support. When we respond early, we often prevent a small problem from becoming a bigger one. Now, it is important to separate early recognition from final diagnosis. Early recognition is what you and your loved ones can do at home. It is noticing changes and taking them seriously enough to mention them. It is writing down when symptoms started and what has changed. It is not labeling yourself with a disease. A final diagnosis is what a healthcare team does after evaluation, testing, and careful reasoning. These are two different steps, and confusing them is one of the main reasons health information can feel frightening. For example, if a senior feels unusually fatigued for several days, that does not mean they have Nipah virus or any specific condition. Fatigue has many causes, including sleep, dehydration, medication effects, stress, or a common infection. But noticing that fatigue and mentioning it early can help a doctor ask the right questions, check the right vital signs, and offer guidance before complications develop. Early detection also means understanding that timing supports the immune system. The body responds better when it receives rest, fluids, and medical attention before stress builds. Simple science tells us that prolonged strain can weaken resilience. Early support protects the nervous system and helps the brain stay clearer, which is especially important for older adults who may become confused more easily when the body is under stress. In my experience, seniors often worry that paying attention will make them anxious. The opposite is usually true. When you notice calmly and act early, you feel more in control. Fear grows in uncertainty. Confidence grows in clarity. So when we say early detection saves lives, we are not talking about chasing fear. We are talking about listening to the body, respecting small changes, and allowing medical care to be thoughtful and timely. That is the quiet power of early detection. Early signs of Nipah virus. Early signs of Nipah virus are often quiet and easy to overlook. That is one of the reasons doctors emphasize awareness rather than alarm. In the beginning, the body may not send strong or dramatic signals. Instead, it may communicate through changes that feel familiar or harmless, especially to older adults who are used to adjusting to small shifts in energy or comfort. One of the most common early signs is general fatigue. This is not the kind of tiredness that follows a busy day. It can feel deeper and less relieved by rest. Some people describe it as a heaviness in the body or a sense that daily tasks require more effort than usual. Because fatigue is so common in later life, it is often brushed aside as normal aging, poor sleep, or stress. Low-grade fever or feeling slightly warm can also appear early. It may come and go and never reach a level that feels concerning. Along with this, some people notice headaches that are dull rather than sharp, or muscle aches that feel like the beginning of a mild flu. These sensations are easy to ignore, especially if appetite remains mostly normal and daily routines continue. Changes in alertness can be particularly subtle. A person might feel mentally slower, less focused, or unusually sleepy during the day. Conversations may feel more tiring. Reading or watching television may require more effort. These changes can be mistaken for boredom, dehydration, or medication side effects. In older adults, the brain often adapts quietly, making these shifts harder to recognize as signals. So why are these early signs so often mistaken for ordinary fatigue in seniors? One reason is experience. Older adults have lived through many periods of illness and recovery. They know that bodies change and that not every symptom means something serious. This wisdom is valuable, but it can sometimes delay attention when a pattern is new or persistent. Another reason is that aging bodies often manage stress differently. The immune response may be slower and less dramatic. Instead of a strong fever or obvious illness, the body may respond with low energy and subtle neurological changes. This quieter response does not mean the body is failing. It means it is responding in its own way. In my clinical experience, the key is not to react to a single symptom, but to notice patterns. Fatigue that lasts several days without a clear reason. Headaches that feel different from usual. A noticeable change in mental sharpness that others begin to observe as well. These patterns deserve attention, not fear. Early signs are not a diagnosis, they are information. When seniors and caregivers treat them as such, they create an opportunity for timely support. Calm observation allows doctors to evaluate thoughtfully and helps the body receive care. Before strain builds, that gentle awareness is one of the most effective tools we have in protecting health and preserving clarity as we age. Why timing changes outcomes. In medicine, timing is often the quiet factor that shapes outcomes long before treatment decisions are made. The body is not a machine that suddenly breaks. It is a living system that responds moment by moment to stress, infection, rest, and care. When something like a virus enters the body, the immune system begins working immediately. How early that process is supported can make a meaningful difference, especially for older adults. Simple science helps explain this. When the body detects an infection early, immune cells have more time and energy to respond in an organized way. Inflammation stays more controlled. Vital systems like the brain, lungs, and heart experience less strain. When detection is delayed, the immune response may become more intense and less balanced. This can place additional stress on the nervous system and make recovery more complicated. I often explain this to patients by comparing it to a small fire. If you notice smoke early and act calmly, the fire can be contained with minimal damage. If the smoke is ignored and the fire grows, the response must be more aggressive, and the risk of lasting damage increases. The fire itself is the same. The difference is when it is addressed. We see this principle clearly in many common infections. With urinary tract infections in older adults, early treatment often prevents confusion and hospitalization. When detection is delayed, the same infection can lead to significant changes in thinking and balance. With respiratory infections, early rest and care can prevent pneumonia. Timing does not change the existence of the infection, but it changes how much the body must struggle. Nipah virus follows a similar logic, even though it is much rarer. Early awareness allows doctors to monitor neurological function closely and support the body before the brain experiences excessive stress. The goal is not to eliminate all risk. The goal is to reduce strain and preserve clarity and stability. For seniors, this matters even more because the brain is sensitive to stress. When the body is overwhelmed, older adults are more likely to experience confusion, weakness, or slower recovery. Early support helps the brain stay oriented and resilient. It also reduces the emotional toll of uncertainty, which itself can tax the nervous system. In my years of practice, I have seen how early attention often leads to calmer care. Patients feel heard sooner. Caregivers feel guided rather than rushed. Decisions are made thoughtfully rather than urgently. This creates a healthier environment for healing. Timing is not about racing against the clock in fear. It is about giving the body space to respond wisely. Early detection creates that space. It allows medicine to work with the body rather than trying to catch up after strain has already built. That is why timing quietly changes outcomes, especially as we age. How doctors detect Nipah virus. When doctors think about detecting Nipah virus, the process is far more thoughtful and calm than many people imagine. It does not begin with complicated machines or alarming procedures. It begins with listening. Careful listening to symptoms, timelines, and subtle changes is often the most important first step, especially for older adults. Early evaluation starts with understanding how a person feels compared to their usual baseline. Doctors ask when changes began, whether they appeared gradually or suddenly, and how daily routines have been affected. For seniors, this includes asking about sleep, appetite, balance, memory, and alertness. These questions are not meant to point toward a single diagnosis. They help create a clear picture of how the body and brain are responding. Vital signs are another quiet source of information. Temperature patterns, heart rate, blood pressure, and oxygen levels can reveal how the body is managing stress. Small shifts over time often matter more than a single reading. Doctors look for consistency, change, and trends. This approach helps avoid unnecessary worry while still remaining attentive. When further evaluation is needed, doctors choose tests carefully. Blood tests may be used to understand how the immune system is responding. Imaging or neurological checks may be considered if there are changes in thinking, coordination, or awareness. These steps are taken thoughtfully with the goal of gathering information rather than creating fear. Each test answers a specific question and helps guide the next decision. One important thing I always tell patients is that testing does not equal diagnosis. Tests provide pieces of a puzzle. Doctors interpret them alongside symptoms, medical history, and overall health. Especially in older adults, many findings can have multiple explanations. A good clinician takes time to consider context rather than rushing to conclusions. Monitoring is also a key part of early detection. Sometimes the most helpful action is careful observation over a short period. This allows doctors to see whether symptoms improve, stay the same, or change. Monitoring respects the body's ability to recover while keeping medical support close at hand. In my experience, seniors often worry that seeking evaluation will lead to overwhelming interventions. In reality, early evaluation often leads to reassurance. It confirms that symptoms are being taken seriously and that support is available if needed. It also allows caregivers to feel guided rather than guessing. Detecting Nipah virus early is not about dramatic discovery. It is about steady attention, calm assessment, and respectful care. This approach protects both the body and the mind. When doctors detect early changes thoughtfully, they create space for the body to respond and for patients to feel safe and supported throughout the process. Early symptoms in older adults. Early symptoms in older adults often appear as gentle shifts rather than obvious illness. That is why they can be easy to miss, even by people who know their bodies well. These changes do not arrive with loud alarms. They arrive quietly, woven into daily routines, and they ask for attention rather than conclusions. One of the earliest changes many seniors notice is a difference in alertness. A person may feel mentally slower or less sharp than usual. Conversations may take more effort. Following a television program or reading the newspaper may feel tiring sooner than expected. These moments are often brushed aside as normal aging or a poor night of sleep. Sometimes they are exactly that. Other times, they are the body signaling that it needs support. Changes in energy are also common. This is not just feeling tired at the end of the day. It can be a steady sense of low stamina that does not improve with rest. Tasks that were once routine may feel heavier. A short walk may feel longer. Household chores may be postponed more often. Because energy naturally fluctuates with age, these shifts can feel familiar and unremarkable. Daily habits can change in small ways as well. Appetite may decrease slightly. Sleep patterns may shift. A person may nap more during the day or wake feeling less refreshed. Balance may feel subtly off, even without falls. None of these signs alone point to a diagnosis. Together, they form a pattern that deserves gentle attention. It is important to be very clear here. These early symptoms are not a conclusion. They do not mean a person has Nipah virus or any specific condition. Many common and treatable factors can cause similar changes, including dehydration, medication effects, mild infections, or emotional stress. The purpose of noticing is not to label, it is to inform. In my clinical experience, outcomes are often better when seniors or caregivers mention changes early, even when they seem small. Early conversations allow doctors to ask the right questions and offer guidance before strain builds. They also reduce the emotional burden of wondering and worrying in silence. Older adults sometimes hesitate to speak up because they do not want to be a bother. I want to gently reassure you that paying attention is not overreacting. It is respectful of the body. It is an act of care. When early symptoms are treated as information rather than conclusions, they become powerful. They help doctors support the body calmly. They help caregivers feel grounded. Most importantly, they help seniors stay engaged and confident in their own health journey. Early awareness is not about fear. It is about partnership between the body, the patient, and the care team. That partnership begins with noticing, listening, and responding with patience and clarity. Before we continue, I want to pause for a moment and speak to you directly. Conversations like this are not just about sharing information. They are about building understanding and trust over time. When we talk about early detection and timing, we are really talking about how we care for ourselves and for one another as we age. Many of you watching are seniors who have learned to listen carefully to your bodies through decades of experience. Others are caregivers who notice changes before words are spoken. Both roles matter deeply. The quiet attention you bring to health is not small. It is one of the strongest forms of prevention we have. If this conversation has helped you feel calmer or more confident, that tells me we are doing something meaningful together. Education should never rush you or pressure you. It should leave you feeling steady and supported. That is the purpose behind every video we create here. I also want to be open with you. Channels like Senior Health Daily continue because of the community that surrounds them. When you choose to stay, to listen, and to engage, you help this space remain thoughtful and reliable for others who may be searching for answers in a moment of uncertainty. So I want to gently share this with you. I'm Dr. Evelyn Carter from Senior Health Daily. If this video has helped you better understand your health, please consider subscribing, liking, and sharing Senior Health Daily. Your support truly encourages us to continue creating calm, helpful, and trustworthy health content made especially for you. There is no urgency in this invitation. It is simply an open door. Subscribing allows you to return whenever you need guidance. Liking helps this information reach others who may benefit. Sharing extends reassurance to friends, family members, or caregivers who might be quietly searching for clarity. As we move forward, remember that learning together is a process. You do not need to absorb everything at once. You do not need to remember every detail. What matters is that you feel more equipped to notice changes, ask questions, and respond with patience. Your presence here tells me that you value understanding over fear and calm over confusion. That shared value is what makes this community special. Let us continue this conversation with the same steadiness and care that supports good health at every stage of life. Nipah Virus Risk for seniors. When seniors hear the word virus, concern often rises quickly. This reaction is understandable and deeply human. With age comes experience, and experience includes memories of illness, hospital stays, and times when the body did not recover as easily as it once did. Many older adults have lived through outbreaks, personal health scares, or the loss of friends to illness. When a new virus is mentioned, those memories can quietly surface and shape how risk feels. Another reason concern feels stronger in later life is the awareness of vulnerability. Seniors know that the body changes with age. Healing may take longer, energy may be lower, the immune system may respond more gently than it did years ago. This awareness is not weakness, it is wisdom. But when information is delivered without context, that wisdom can turn into worry. From a geriatric perspective, it is important to say this clearly. Risk is never the same for every individual. Age alone does not determine outcome. Overall health, medical care, early attention, and emotional stability all play meaningful roles. Many seniors remain resilient and respond well when changes are noticed early and care is supportive. One of the greatest challenges I see in older patients is the emotional toll of fear itself. Anxiety places real stress on the nervous system. It can disrupt sleep, appetite, and mental clarity. For the brain, feeling threatened over time can be more exhausting than the illness we are discussing. That is why calm, accurate information is so important. Doctors who specialize in aging focus not only on disease, but on function. We ask how someone is moving through their day. We look at cognition, balance, mood, and independence. When a potential infection is considered, the goal is to protect these functions. Early awareness allows for monitoring and gentle intervention rather than emergency response. Seniors also tend to worry about being a burden. Some hesitate to mention symptoms because they do not want to alarm family members or disrupt routines. I want to gently reassure you that speaking up is not burdening anyone. It is an act of partnership. It gives caregivers and doctors the opportunity to support you calmly and thoughtfully. A realistic and reassuring view of risk acknowledges both caution and confidence. Yes, seniors deserve careful attention when it comes to infections, but they also deserve reassurance that awareness does not equal danger. It equals preparedness. In my experience, older adults feel most at ease when they understand what doctors are watching for and why. Knowledge restores a sense of control. It allows seniors to stay engaged rather than fearful. When risk is framed with context and compassion, it becomes manageable. The goal is not to eliminate concern. The goal is to keep concern from overwhelming the nervous system. Calm understanding protects the brain, supports decision-making, and allows seniors to move forward with steadiness and trust in their care. Detection timeline and medical response. When we talk about a detection timeline, we are really talking about how care unfolds over time in a calm and organized way. It is not a countdown clock, and it is not a race. It is a sequence of attentive steps that allow doctors to understand what the body is doing and how best to support it. especially in older adults. The timeline often begins before anyone steps into a clinic. It starts at home, with awareness. A senior or caregiver notices a change that feels different from the usual pattern. That observation is the first point on the timeline. Writing down when the change began and what has shifted can be surprisingly helpful. It gives doctors context and helps them see the full picture rather than a single moment. The next phase is medical evaluation. This usually involves a conversation first. Doctors ask about symptoms, daily routines, recent exposures, and medical history. For seniors, this conversation is essential because subtle changes matter. Vital signs and basic assessments follow, not to alarm, but to establish a baseline. Baselines help doctors recognize whether the body is stable, improving, or under strain. If monitoring is needed, it is often done thoughtfully over time. This may include follow-up visits or short-term observation. Monitoring respects the body's ability to recover while keeping medical support close. For older adults, this approach reduces unnecessary stress and allows care to adjust gently if changes appear. Medical response also includes supportive care. Rest, hydration, nutrition, and a calm environment are powerful tools. The nervous system responds best when it feels safe. Loud settings, rushed decisions, and constant interruptions can increase confusion and fatigue in seniors. A quiet, familiar space supports clarity and balance, which are important for recovery. Early detection allows medical response to remain measured. Doctors can guide care without urgency or pressure. This reduces the likelihood of hospital complications and helps preserve independence. It also gives caregivers time to understand instructions and ask questions without feeling overwhelmed. In my experience, the most effective timelines are those built on communication. Seniors feel more secure when they know what to expect next. Caregivers feel more confident when they understand the plan. Clear explanations reduce anxiety, and reduced anxiety supports the brain. An important part of the timeline is reassessment. Doctors check in to see how symptoms are evolving. Improvement is noted and celebrated. If something changes, the plan adjusts. This flexibility is a strength, not a weakness. It allows care to remain responsive rather than reactive. Ultimately, a thoughtful detection timeline protects both the body and the mind. Early monitoring and supportive response prevent small concerns from becoming larger problems. They create space for healing and for calm decision-making. For seniors, that space is invaluable. It supports dignity, stability, and trust throughout the care process. I want to speak directly to the caregivers who are watching. Your role is quiet, constant, and deeply important. You are often the first to notice changes that others might miss. A shift in mood, a slower response, a new pattern of fatigue. These observations are not small. They are the foundation of early detection and thoughtful care. Caregivers see the everyday rhythms of a person's life. You know what is normal and what feels different. That familiarity allows you to recognize subtle changes long before they become obvious to clinicians. This is especially true for older adults whose symptoms may not follow textbook descriptions. Your awareness provides context that no test can replace. Patience is one of your greatest strengths. Many changes unfold gradually, and it can be tempting to dismiss them or wait for certainty. Patience does not mean delay. It means observing without panic and responding without pressure. It means allowing time to reveal patterns while staying ready to seek guidance when needed. Communication is where your role becomes most powerful. Sharing observations clearly and calmly helps doctors understand the full story. Mentioning when symptoms started, how they have changed, and what seems to help or worsen them guides evaluation. Even details that feel small can be meaningful. Your voice helps shape medical decisions in a way that supports the whole person. Caregivers also protect emotional safety. Older adults often mirror the emotional tone around them. When caregivers remain calm and reassuring, the nervous system responds more favorably. Anxiety can increase confusion and fatigue. Reassurance helps preserve clarity and cooperation. Your presence creates a sense of safety that supports both physical and mental health. It is also important to care for yourself. Caregiving requires energy, focus, and emotional resilience. When you feel supported and informed, you are better able to support others. Asking questions, seeking clarification, and sharing concerns are not signs of weakness. They are signs of commitment. In my clinical experience, the best outcomes often involve strong partnerships between seniors, caregivers, and medical teams. Each brings a unique perspective. Caregivers bridge the gap between daily life and clinical care. That bridge allows early detection to happen gently and effectively. I want you to know that your work is seen and valued. The quiet attention you provide helps prevent crisis. It allows care to unfold with dignity rather than urgency. By observing patiently and communicating clearly, you help create the conditions where timing truly saves lives. Your role is not to diagnose or to fix. Your role is to notice, to support, and to speak when something changes. That role is powerful. It makes early detection possible and gives seniors the best chance to remain safe, calm, and well-supported throughout their health journey. Preventing severe outcomes through awareness. As we come to the close of this main discussion, I want to gently bring our focus back to the heart of everything we have talked about. Awareness is not about anticipating the worst. It is about reducing strain on the body and protecting the brain by responding early and thoughtfully. When awareness is present, severe outcomes become less likely, not because risk disappears, but because the body is given support before it is overwhelmed. Early detection creates space. It gives doctors time to observe changes carefully. It gives caregivers time to respond without urgency. And it gives seniors time to rest, hydrate, and receive guidance while the nervous system is still steady. Simple science tells us that prolonged stress increases inflammation and weakens resilience. When awareness shortens the period of unrecognized strain, it helps preserve strength and clarity. In my years of caring for older adults, I have seen this pattern repeatedly. When early changes are noticed and shared, care often remains calm and supportive. Hospitalizations are sometimes avoided. Confusion is less severe. Recovery is steadier. Even when illness progresses, it tends to do so with more dignity and less chaos. That difference matters deeply for quality of life. Awareness also protects emotional health. Fear often grows in silence and uncertainty. When seniors and caregivers understand what to watch for and why, anxiety softens. The brain responds better when it feels informed rather than threatened. Emotional safety supports sleep, appetite, and cooperation with care, all of which influence physical outcomes. It is important to remember that awareness does not mean constant vigilance. It means gentle attention. It means noticing patterns rather than reacting to every sensation. It means trusting that small steps taken early are meaningful. This approach respects the body instead of pressuring it. Preventing severe outcomes is rarely about a single dramatic action. It is about a series of calm decisions made at the right time. Mentioning a change sooner rather than later. Asking a question instead of waiting in silence. Creating an environment that feels safe rather than rushed. These choices accumulate, and over time, they shape how illness unfolds. As we prepare to move into the closing reflection, I want you to hold on to this idea. Knowledge is most powerful when it brings steadiness. Awareness works best when it is paired with patience and trust. You do not need to control everything. You only need to listen, respond, and allow care to unfold with clarity. Early detection does not promise certainty. What it offers is something equally valuable. It offers the chance for the body and the mind to be supported before stress takes over. That is how awareness helps prevent severe outcomes. It creates room for calm care, thoughtful decisions, and a gentler path forward, especially as we age. Thank you for staying with me until the end of this conversation. Your time and your willingness to listen with care truly matter. Choosing to learn calmly is already a meaningful step toward protecting your health and the health of those you love. Early detection of Nipah virus is not a story of fear. It is a story of understanding. When we understand how the body communicates and why timing matters, uncertainty becomes less overwhelming. Knowledge gives shape to concern and turns it into something manageable. It allows us to respond with steadiness instead of panic. To the older adults watching, I want to offer gentle reassurance. Your body and your brain respond best when they feel safe and respected. Calm awareness supports clarity, balance, and resilience. Stress and urgency place extra weight on the nervous system, but patience and understanding allow it to function more smoothly. Your body has supported you through many chapters of life, and it continues to respond positively when it is met with trust and care. To the caregivers, I want to say thank you. Your patience, your steady presence, and your attention to small changes make a real difference. You help turn information into reassurance and concern into thoughtful action. Your role is often quiet, but its impact is profound. As we close, I invite you to remember that you do not need to hold everything at once. You do not need to memorize details or worry about every sensation. What matters is knowing that noticing early and asking questions calmly can protect both the body and the mind. If you ever need a place where health information is shared with warmth, clarity, and respect, Senior Health Daily is always here for you. You are welcome to return whenever you need reassurance or guidance. Let this final thought stay with you. Knowledge should bring reassurance, not pressure. Take a gentle breath, thank your body for all it continues to do, and allow yourself to rest in understanding.